Welcome back. Whether you are suffering pain from maybe an athletic injury or simply the effects of getting older, you might be surprised to learn about an option here in Southwest Florida that can help without surgery. It's called Prolotherapy. It's creating a lot of buzz in our area, and let us now introduce you to the doctor who is bringing this non-surgical option to Southwest Florida. From Caring Medical Center, I'm so happy to welcome back to the show once again Dr. Ross Hauser. Good morning.
Yeah, thanks, Charlie, for having me.
Doctor and prolotherapist, which we've been talking here a little while about prolotherapy, which we're going to discuss again this morning. But let's talk about foot pain. And I know this is extremely common. So what happens, foot pain a lot just as we get older?
Yeah, all the weight of the body obviously goes into the foot. And most of us try to have good shoes, but we don't realize in cultures where they don't wear shoes, Carly, they have almost no foot pain. So all the footwear that I wear and you wear, all this comforting thing, it actually makes the foot weaker.
And something else that I think the athletic community, certainly they're on their feet, they're doing a lot more things, pushing their bodies. They'd, I'd imagine, have a lot of foot and ankle pain too.
Yeah, and they've shown that runners, when you run in your bare feet, you actually put less strain on your knee, for instance, than all the shoes where they have all the cushioning. So more and more runners, me included, I don't know if you know this, but I did 5 Ironman triathlons, so I'm an endurance athlete.
Yeah.
So I do a lot of my running, you know, with minimalist shoes. And then soon, I haven't started it yet, but soon I'm going to start running in my bare feet.
There's a lot of joints and ligaments in there, and that's where prolotherapy comes in and can possibly help.
When somebody has chronic pain, and chronic means more than 3 months, then basically the tissue needs to be regenerated or strengthened. Like once your body won't heal it, you need some assistance to heal it. So whether it's plantar fasciitis, joint instability in the ankles, bunion pain, you know, any sort of like degenerative condition in the foot or the ankle, prolotherapy is a really great alternative because prolotherapy restarts the healing process.
Well, and you know, I don't know how many alternatives there really are other than people just say, oh, we'll wear a different kind of shoes. So I think people are going to be excited to know that, hey, there is something that maybe can help what the issue is. So explain what prolotherapy
Unfortunately,
is.
I'm kind of like the doctor of last resort. I mean, I'd love to see people sooner, but it's common for me to see somebody after they've had cortisone shots, taken anti-inflammatories, had surgeries. So then they come here to get assessed for prolotherapy, whether somebody's a good prolotherapy candidate or not. But just simply, prolotherapy is a natural injection therapy, natural. So we inject natural substances into like the plantar fascia, or into the ligaments, or into a toe like a bunion. And what prolotherapy does is restart the healing process. So the body heals by an inflammatory process. So when you work out, your muscles get inflamed. So it's that inflammatory process that actually stimulates your muscles to get stronger, bigger. So all we do with prolotherapy is we start the natural inflammatory process to get the plantar fascia stronger, the joint stronger, the ligament stronger. So over a period of several months, you know, some people it's just a few weeks, but normally when I see a chronic pain patient, I'm going to have to see them for a few months. But slowly, methodically, they get stronger, the tissue gets stronger, and then often we get runners back to running.
Well, and I think what people are going to love about this is a non-surgical option. I think so many people, you know, either they don't want surgery if they don't have to have it, and this is an option that they can consider.
No, exactly. And then of course people love natural, so all we're doing is restarting the healing process with natural substances. So we just
like what? Give us an example. What substances are you using?
Well, we usually use what's normally in the body, whether it's a fat or it's a sugar. The normal sugar in the body is D-glucose, and sometimes we use the cells. We use like platelets that are in your blood, or we use substances that are in your bone marrow or fat, depending on the condition. So we just start the healing process so the tissue slowly, methodically over time gets stronger.
Well, and what I love is that you're so honest, and I know you're very passionate about educating people on what it is that prolotherapy is doing for people. It may not be the option for 100% everybody, but it is an option to consider. So if someone is watching this morning, they've been dealing with a lot of foot pain, they think, you know, surgery is maybe their only option, or they don't know what to do, I would certainly encourage you to call the doctor here What's the best thing to do? Call, make an appointment, see you?
Yeah, we have a great website, so I would say check out the website.
That's your first destination.
Yeah, and then obviously we'd love to see people and see if they're a good prolotherapy candidate. So to do that, we'd see them in the office.
Meet with you and find out what prolotherapy is all about. And I know that this is going to be going like crazy all over Southwest Florida once people realize what you guys are able to do for people. So thank you for being on the show this morning. We always love having you here, and we look forward to coming back. Thank you so much, Doctor.
Yeah, you too.
For more on Caring Medical, all you have to do is head to our website, foxformorningblend.com.